Alrighty, hello guys. I'm gonna sit down a little bit before I say what I'm gonna say. Hello guys, Eugene Twins here with Performance and Wellness. I'm excited here. I'm in the room with an OG if it comes to the wellness genre. I let him introduce himself.
So Eugene is going to be here with you. I'm James Waslaski. I teach about 45 weekends a year across the globe, integrated manual therapy and orthopedic massage. And I'm honored to see Eugene. It's been quite a few years since we've last been together.
Yes, it has. This guy right here, how much I mean, I met him at Lifetime Fitness back, 2006 or 2007?
I think it was 2006.
Okay, I met him in 2006. He came in and I was bugging him. I'm like, man. And I think, I'm trying to figure out, how did I know what you did? So I met you, I think I spoke to you, I researched you online, or I found you online. And I'm like, yeah, I found you online. And you had to come to the gym that I go to. And I was like, I was just getting out of school and everything. I'm just trying to find my way. And I bugged this man about a class. And I was like, when your next class is going to be? And I think you told me when it was. And I was like, man, I don't have the money for it. You know what? You said, let me tell you what. I'll work something out with you. We'll figure something out when we can take the class. My next class is this time right here. Anyway, long story short, I was training back then. We worked out something, took care of his wife. He was excited, he was, excited about, her getting taken care of, and I was excited about learning something new. Because I'm all about learning and being a student of my craft. So I was really ecstatic. I learned a lot in his class. He's a fantastic teacher, hands above anything that I've ever learned, especially being in school and to come out doing certification type of services. And it kind of complemented what I knew already. So don't be ashamed to learn something new. It's always good for you. Let's say you stop learning, it's time to lay down and take a nap, take a dirt nap. So, man, I'm really excited to have this time with him, to speak with him about his program, and we're just going to touch base on everything wellness. This guy is super intelligent, super intelligent. He has a lot of things up his sleeve that he may can share nuggets to kind of help you out there, or if you're a student looking for continuation classes, this is guy to look up. So, furthermore.
So Eugene, a little background is I was a paramedic firefighter for 20 years, and I did massage as a hobby, but then I met people, some of the legends we've been talking about. I met Aaron Mattis right out of the massage school. I met Benny Vaughn right out of the massage school. I met world leaders like Paul St. John. And Fran and I were very blessed because we trained in Florida, where some of the top names from Upledger to you name it. And so our training right out of the massage school was the clinical modeling. It was like, okay, what's going on? Is it a bone problem, a ligament problem, a nerve problem, a scar tissue problem, a muscle imbalance problem?
Yeah.
And back to the teaching model, I was with my friend and colleague Kerry D'Ambrosia last week in Toronto, and he said his mentor is 98 years old. He still sees, he's an osteopath. He still sees 8 to 15 clients a day, and he still takes courses. So what I've learned in the evolution of being with great colleagues is you never stop learning, and the more you know, the more you realize you don't know.
And that's true. And that's the same thing I learned from you, because before I met you, I'm a self-taught person, and I go along at my pace, but I'm passionate about what I do for a living, and my purpose and my goal, I want to give to others. And it makes me feel good to help you be a better you.
Yeah.
And that's what I noticed when you being in your program, you were so passionate about teaching the students. And it's like you wasn't there to take their money. You wasn't there to, you didn't give a half-ass program. It was a really intelligent program where people were in tune, they could ask you questions, they could do, and you would go over and beyond to help the person out. And what recognition would do, you gave recognition. And that was the respectful thing. And that's what I love about your program. And I call you the GOAT. You were like one of the OGs in the wellness area, and I do appreciate you and your time you put in for me personally to learn, because you were a purpose for me learning my first steps before I transitioned to other things. But in the same area, you were my first mentor in the space of wellness, mobility. I even joint traction, manipulation. I learned all this stuff from this man right here. And that's why I'm able to help a lot of people out there right now.
But you mentioned mentors, and I think that the key factor here is respect your mentors.
Yes.
And if it hadn't been for Aaron Mattis and Benny Vaughn and Eric Dalton and many of the industry leaders, we wouldn't be sitting here.
No, we wouldn't.
I wouldn't be traveling to 15 countries around the world teaching.
And that's really good.
So what I love about giving honor and credit is every workshop I'll do, if I show a spinal biomechanical thing, and I learned it from Eric Dalton, I'll say, this is where I learned it. It's not name dropping. It's not bragging.
It's giving credit where credit
It's
is
simply respect for the fact that, you know, when I met Fran way back in the 90s, I really didn't, now I know all the scaling attachments. There's a lot I didn't know. There's a whole lot I didn't know. Even since you were in the class, we've done a lot more spinal biomechanic work. We've done a lot more kinetic chain work. We do a lot more scar tissue work. Microcurrent. I mean, more head injury, concussion, brain trauma, relationships to the kinetic chain of what's going on with the body. So I think, and the other point is, when you're there, like in Toronto last week, and we had a couple of people, they started crying because they go, I've had a head injury and concussion for 12 years. And between my colleagues and myself, we sorted all that out. You know, the head injury concussion was treated, the energetic connections to the emotional guarding was addressed. They felt, and what they said is they felt loved. They felt touched by compassion. And we looked at it from a global perspective. It was like, okay, do we start with energy work or cranial work or visceral work or lymphatic work? Back in the days, it was all about one modality. You know, and now the colleagues have come together and supported each other from every aspect of manual therapy. And the more modalities we learn about visceral and lymphatic and cranial osteopathic and spinal nerve traps, the more we learn, the more we realize, wow, gosh, I'm almost embarrassed what I taught way back in 2000s, but I wasn't, because it was good.
It was valid at the time.
But there's always another level, and I'm passionate about learning that next level. Always being the student. And
the same I was. So whenever I learned from you, and I'm like, because you allowed me to take the whole program, and then when I left you, I'm like, okay. Then I came across Aaron Mattis, because I know back then there was nobody stretching. There was not doing it elongating movements. And I'm gonna touch base on this too in a second. And I sought out Aaron Mattis. I called Aaron up, blase. He was like, oh, sure. Talked to Aaron Roger McNear. I went to the class, we took the whole program. And I'm like, I said, Aaron, do you know Joe? I did the first class. I said, you know Jim? He said, yeah, I know Jim. You know, well, I called you Jim. I called you Jim, but I know it's James.
It's all good.
But he knew who you was. I said, what's his name? Yeah, I know him. He was one of my, he kind of went on. He talked highly about you. And I'm like, yeah, I take it from him. He said, he's a good dude. And everything, a lot of stuff I knew and I learned in this class, I'm like, I learned this already. I learned this too. What's his name? He said, yeah, he's one of the students that I know that always gives me credit. He always mentions my name. And he loves you back then. It's been years I took the class.
He's like family to us. We've been on the cruise ships and talked together 3 or 4 times with him and his wife. And they're like family. And I have to tell you an interesting story. When I was even still in massage school, it was 1990, I had an opportunity to teach at the FSMTA. And I'm teaching the sports massage class, and I didn't know the difference between stretching, soleus, and gastro. So Aaron was sitting in the crowd. So I go to Aaron, I go, Aaron, can I field that question to you? He goes, no, young man, I want to hear your answer. So he put me on the spot, and then he said, at the end, he goes, you have great potential, right? Which was good, because he saw the potential, and yet I was such a rookie at the time that I was trying to use him to answer the questions I didn't know.
And
he's a great guy.
He's a very kind man. Very gentle. He said, well, you do this, gentle pressure. So with that said, these are my mentors. He's one of my mentors. Aaron's my mentors. They've been around for a long time. They know the body ins and out like none other. I learned a lot from them. I'm continuing education. I learned a lot about fashion now, because I work with clients on a regular basis. I work with ignorant clients. Working out, training, bodybuilding, weightlifting. It's exhausting to watch people damage their bodies and go through movements and range of motion which they have no idea what they're doing, and it disgusts me, and it makes me really frustrated, and it puts healthcare at jeopardy because you're driving the cost for stuff and you're teaching people in proper way how to function, take care of their body, and that's not good. I think everybody needs to be educated in some kind of way. And it comes to mobility and muscle contraction and how things work. So, and this is what James teaches, and he covers everything like in really real-time detail. So let me ask you this question. So you said you're an athlete. You military?
I ran marathons most of my career. I ran at 2:39 at the Boston Marathon. It was really more into running. Now I'm more into cycling and swimming. But yeah, I got introduced to massage because I got a sports massage session way back in probably the 80s, and I was intrigued by it, but then I really didn't decide to take it until 1990.
Okay, and then when you started taking 1990, that's when you. Are you a self-taught, or did you kind of?
No, I went to massage school in Tampa, and my guest speakers were Aaron Mattis, Michael McGillicuddy, Paul St. John. I think Upledger made an appearance at one point at my school level.
Wow!
So it was pretty amazing to have a school that was like. And a lot of them were graduates at the same school, Suncoast School of Massage in Tampa.
Wow, man!
So we were, Fran and I were lucky. Fran trained with Paul St. John right out of massage training. So we were very blessed to live in Florida. So in fact, that's how we met. She went to a conference in Texas, and the people were great. But the numbers were really small, and she missed the big conferences like the FSMTA, and I met at the FSMTA in Miami. Wow. So it was really, it's funny how the universe works and reconnecting. And now I just go, where's my, I was with Kerry D'Ambrosio and two osteopaths in Toronto. I go, I want to learn more cranial. I want to learn more scoliosis. I want to learn more visceral organ. You know, I just got certified in lymphatic drainage with Kerry D'Ambrosio. Again, I still feel like the wiser we get, the more we realize there's still something missing that could that could change the face of manual medicine.
You know what? And you're correct. And I'm gonna share this with you. Not to keep going about this. When I took Aaron's class, his advanced classes, we covered scoliosis. Yeah. I'm telling you something. When you, this man now it's on a, I don't know, it's on different. It's like a crazy level of understanding. It's crazy. But I learned quite a bit about that. But I'm still a student of my craft. I'm still learning all the time. I don't never know enough. And I just continue to keep my brain functional when it comes to bringing something to the table to help the next person out.
And Eugene, I was like, in high school, I barely passed high school because watching a lecture, reading a book, and taking a test, I was horrible at that. So my daughter Alex, her friend's daughter Alex, is very similar with autism, dyslexia. Her brain cannot read a book, take a test, and do that. And she has to feel the kinesthetic, visual, auditory learning. So Fran pretty much went back to school when Alex went to school. And through showing her it on the skeleton and testing, I think one of the reasons I'm a better teacher is because of the way their brain processes information helps me to go, I don't want to dummy it down, but I want to simplify it. So we'll show them a picture, an example, we'll show them a picture of the SI. Okay. And a lot of people have an iliosacral torsion. Okay. And Alex is really cool. So go ASIS. There's only 3 bones. She simplifies it. You take these bones, you spread them apart, which relaxes ligament, and you get the bones moving. You put them where they're even. But one thing I learned is that her and I both learn better if we're in the table first. So we're more kinesthetic. Number 1 is our kinesthetic. Number 2 is our visual. We have to see a picture of what's happening while we do the technique. And auditory learning, I think, is the least strength of most manual therapists. I believe you. Unless they see an image of that scar or an image of that joint or muscle or ligament and feel it being done kinesthetically and then duplicate it after they feel it as they look at a picture and an image. I think when you combine the visual, auditory, kinesthetic style of learning, more people come up to me now and say, you know, I'm autistic or I'm dyslexic or whatever their label is, which really means they're brilliant, but they learn and process differently. And when the teacher can teach the way the brain processes information, the student can learn.
So that's a success. So if you're teaching anybody, if you cannot reach the student, you have not been effective. You basically failed the student. You took the money and you failed the whole process. But with what you're saying, I understand that because you have to be able to reach people on different levels. Myself personally, have you ever seen the movie Good Doctor? The Teacher, Good Doctor?
That's funny you mentioned that.
So I've done this for so many years. That's through my craft. So when I'm working on somebody, if you tell me what your problem is, I can close my eyes and visualize how your body moving, like, you know, scapula out of muscle move. And it's like it's crazy, but it's just, I have to build their memories. I can remember it, I can walk you through, close my eyes, and tell you what's going on, and I kind of point you in places. That's audio for me. Visual, I can look at you right now. I did a client session like a month ago. He had a shoulder problem. Okay. I said, let me watch you work out. I watch you get all the movements, and I say, you got this problem, this problem, this problem, this problem, this problem, this problem right here, this problem here. And he has a trainer that worked with him. So you know what they say. It doesn't say about the trainer. It's just that I'm just that type of person.
Here's what you are. You're getting the body healthy enough to perform without compensation. Yes. Because getting the body healthy enough to move in a balanced, more functional body means you're not stirring up pre-existing conditions.
Yes, what it is.
So what sets you apart is as a trainer, you're going to see a weak serratus anterior, you're going to see something going on, you're going to, let me get back on the table and treat that, and let me watch you move again.
Yep.
And I think that's the new trend of medicine, is good trainers will not do corrective exercise-based rehab when there's still an injury that's been not evaluated, corrected, and unresolved. Corrective exercise-based rehab can stir it up.
Hold on a second. Say it again. I want y'all to hear this, people out there. Trainers, I want y'all to hear it.
Well, I don't want to pick on the trainers. What I want to pick on is the industry.
Yes.
I don't care what title you are. I don't care whether they call you a PT.
Yeah.
The bottom line is you have to look at joint function, ligament function, nerve function, muscle balance, get rid of abnormal, unhealthy scar tissue. You have to get functional movement. And when the functional movement is restored through the manual therapy we can do on that table, then the corrective exercise can retain the outcome, but the corrective exercise can't be done until you correct the problem.
You know what? This man needs he needs a hat for a tip. He needs a tip right now. This is something I've been.
It's so real.
When I say it's so real, they don't understand. And no, I know we're not picking on anyone, so that's what we're not doing. But have a clue, get educated, learn something above what you think you know already. You're still not above learning. That's a really good point. I mean, that need to be coined, seasoned, some kind of way to where it should be the framework of anybody's wellness profession that's actually touching anyone or offering any advice, anything, they need to understand the basics.
And that's the beauty of training with great masters, is learning. I've trained with Eric Dalton 12 times now, between teaching together 6 times and assisting. Yeah. And I only learn about 10% each time. So at 12 times, you learn 10% each time. You do a little bit more. So I first look at spinal biomechanics, but then my colleague, Kerry D'Ambrosio, would look at emotional energy, traumas, life traumas and experiences. And then someone who's had a concussion or head injury would look at the head injury, taking the brain out of the straitjacket. So the more entities you have, the more you can scan that person and go, okay, the hips aren't level, the shoulder's not level, the awesome, but do not do exercise-based therapy.
Oh, Jesus.
Because with like a stuck subtalar joint and an iliosacral upslip, I saw a friend walking out in the nature center back there, and she had an iliosacral upslip. So if you had exercise-based rehab her, it would have made it worse. And yet she found a great physical therapist that said, hey, she's lost the lumbar curve, the herniated bulging disc, you need to get that curve back in. And her therapist, what I loved about her physical therapist is that she's like, I'll try 4 or 5 different things, and if it's not working, it's the wrong thing, and I'll do something different until we get the one that fits the balance of her body to get that normal lumbar curve sitting on that lower sacral base. And finally, and there's a lot of people that would say, old school, piriformis syndrome. The piriformis muscle can hardly ever cause sciatica. You know what I've learned? I took a bunch of Zooms on each one.
I'm gonna get it. Okay.
If there's an iliosacral torsion,
hold on. It's piriformis, sciatic. Okay.
But if there's sciatica, it's usually the sacrum first.
Okay.
And twisted ligaments. So you can't treat the muscles. Then when you do positional release of ligaments, all of a sudden you can get the iliums to move around the sacrum and you can level the sacral base. Then you can do craniosacral therapy. Then you can get nutrients to ligaments. Then you can do corrective exercises because you've restored functional spinal engine. So I always look at the joints and the ligaments and the trapped nerve first, but from massage training, I always looked at the muscles first. But now as I evolved 33 years later, I have to check joint function. I have to check what's going on of the joints and the ligaments and the nerves. But that's not what I learned in the basic massage school. So what I tell people is get a good basic massage curriculum. For me, for Fran and I, we have a great one in Florida. Then take lots of modalities, lots of advanced training, nerve training, joint dysfunction, spinal biomechanics. And as you evolve, you start to look globally at that person. You can just watch them walk and you can tell the problem is, and it's usually where you're treating is not usually where the problem is. It's a compensatory pattern of
when I say you are right on time. And like I said, same thing, because like I said, I get calls from a lot of athletes in the area. They say, that guy, tell you what's going on. And I'm always dead on, and I can solve a problem with a 1-2 session. I had an Olympic weightlifter named Ali. He had this much different. He had one leg, it's like this. And he was in pain for like 8 years. I did 2 sessions on him, and he was good. No pain at all. And he said, I've been to PTs, I've been to this, I've been this, and that. And he's like, how'd you able to do that? I said, you know what? I have a different type of skill. I have a different skill in understanding how the body's supposed to work, muscle, how the ligaments and tendons work. And I would explain to him, you need to, you have imbalances in your body that need to be corrected, and how you correct those imbalances but put your body in a position where you can neurologically receive that energy and that balance, that specific joint, whether it's your hips, because one hip was like high, so he wore a shoe that replaces that height difference. So I know this like the back of my hand. I've done, I got 30 years of experience in this genre of wellness and fitness and everything else, so I'm not ignorant to it, but it's just, I think people need to be educating themselves, whether it's trainers, physical therapists, chiropractors, what have you. If you're working with people and they're listening to you, and you consider yourself an expert, you need to seek out continuing education. Nobody is over anybody when it comes to information.
But I think as we all integrate and play nice together.
Yeah.
I was teaching the chiropractic conference in Florida for like the 7th time. And to be there, you have to be an MD and or a chiropractor. And Dr. Lund is my teaching assistant, Dr. Steve Lund from Clearwater, Florida. And he said to the doctors, if you adjust someone's back, but you don't rebalance, he's telling 200 chiropractors, but you don't rebalance the muscles, treat the scars, treat the trapped nerves, and restore normal muscle firing patterns. That means when you're extending that hip, the glutes and hamstrings. So he's telling them, you're basically, so from a 42-year veteran of chiropractic medicine, he's a leader in his industry, and there's some great chiropractors like him out there, but he's telling them the adjustment will not hold. And if you don't treat the muscle imbalance, the joint capsule adhesions, the trapped nerves, and do the corrective exercises. I'm talking about stretching what's tight, activating.
You see, I just feel you get me chill.
But that's where our industry is going now. Is we're all supporting each other as colleagues, and we're all sharing our strengths to help overcome those weaknesses. And the industry, especially since 2020, has exploded in the integration of world leaders in management.
What took so long?
I don't know.
And I would tell my clients all the time, I said, well, I need adjustment. Okay, what are you doing for you? He said, pop my back. I said, do you understand it takes a certain amount of time for that to set in? You got neurological, you got stuff. There's a time. When he told me to come back 4 times a week or 3, I said, no, that's too much. That's too soon.
Yeah.
You need to
have
think
to
about
reprogram. You have to redo the exercises. If you don't start, if we don't go to people like you doing corrective exercises in a healthy body, the body has to become healthy in the therapy, and then the healthy body can maintain the functional outcomes through the corrective exercises. So, and it has to become neural. Everything is about the brain now. If you don't get the brain processes the information, then what you do with your hands is simply a quick fix. It's that simple.
I'm gonna tell you something. You just obliterated my brain. It's like this. You've been waiting for something like this to come along for so many years, because I've had so many. Matter of fact, I had disagreement with chiropractors. Well, I didn't like chiropractors because they cool now. Everybody's cool now. But it's just I had a problem with them because they were so stuck in themselves. I'm a doc. I'm this and this. I'm like, okay, come on. This doesn't make any sense. Why does this make any sense? Understand your anatomy. Well, this not necessary. Like, you're freaking kidding me. But then they didn't want to take information. It was a superiority situation, and things have changed. It was the thing, because I knew a chiropractor doctor out of Houston, and he's like, I learned grasp factor and taping. He's a fantastic. He worked with the Olympic team. The Olympic team that you had recently in the Winter Games. He was one that lead people down there, and they flew him out there. But anyway, he's a fantastic, exceptional chiropractor. So I do understand that there are chiropractors out there that do care, that do things different, like you're speaking about, that care about the whole body integration versus just. I don't think he really adjusts really. I think he does like stuff like you do. Aaron does. He does a lot of functional type.
But on the other hand, every time I teach at the chiropractic conference, I sit in their classes. I learn. I get an about face every time I see, now we're looking at that subtalar joint that's ascending into that tibial torsion, that's causing that sacral torsion, that's causing that rotoscoliosis, that kyphosis, and that OA joint that's causing your headache is a foot problem.
Yeah.
When you look globally, but I didn't learn that by just training with massage modalities. So in every profession, in respect of every title, in every profession, there's low end and high end.
Yes.
And my goal is to continue to integrate with the high end. And then I might meet a chiropractor who just blows me out of the water, and I go, I didn't think of that. Or a physical therapist like Fran's physical therapist, who was basically, I think Fran wanted me to wear duct tape under my mask because I asked too many questions. But it's true. Back when I knew little, I had more of an ego. And now that I know more, I'm becoming more humble, but I'm also becoming more grateful
Yeah.
because
For
there's so
experiences.
much I still have to learn. I want to be one of those students at 98 years old that still go, that colleague, that mentor in Australia or wherever they're at, it could be here in the US, I still want to study that cranial or that. So as long as you stay hungry
Yes.
and you don't disrespect your colleagues,
No.
you don't like I'll have people go, well, what does the PT know? Well, considering they have their PhD,
Yeah.
they probably know a lot more than we know about certain aspects of clinical rehab. But why don't we be nice enough and humble enough to share the scar tissue work, the muscle balancing work, the corrective exercise, as we all integrate and everybody that does manual therapy comes together, that's when we're going to change the face of medicine. And we have a broken medical system that's giving them Oxycontin and that's giving them drugs and that's doing, in many aspects, unnecessary surgical procedures. But in order to change the face of medicine, we have to learn to integrate first. And then the integrated model will become the new model of preventative medicine.
I agree with you 1,000,000,000%. If it was another billion, I would throw a tree on that. It makes a lot of sense. And like I said, I've been doing this for a very long time. I do agree with you. And like I said, and I'm looking at you know, the fashion from Italy, Dr. Scars.
I don't, because we're doing a retreat every year in Italy starting this year.
No, but they come from.
Oh, they come to the World Fascial Congress. Yeah.
Yes, I took that in California.
Yeah.
I took a pictures with her. I bought her book. It's in the car.
That's good stuff.
And it's only in France, but they have, you know, and you buy the class, the books and everything, you get it, you get the information. Fashion is something that's overlooked.
Yeah.
And I explain to my clients when they have an injury, when any injury, anything becomes a function in the body happens, the fascia compensates. It changes, it molds itself, and does something totally different just to adapt to what your mobility situation is. So if you dress the fascia to a certain extent and get the muscle, neurological, the joints and tendons function again, and it brings everybody to a one whole in peace, and you deal with your limitations, or kind of grow past limitations. Not to get yourself back to 100% because it never happens that way. You just go you start from where you're at now, and then you progress forward.
And on that same line, one of the things I've learned, Tom Myers and I were talking about this because we were on several Zooms together this past year. And he said, remember the old thixotropic state of posture? It doesn't exist. So as soon as you take your hands off, it goes to the same. So unless it becomes a neural change, unless it becomes a brain change, these fascial changes go right back to their connective tissue adhesions, which is why it's good to be at the Fascial Congress. So one of the things we learned, speaking of fascia and scars, is we do microcurrent now. And so if you have a scar tissue problem in your psoas, or you've got an old hamstring strain, or I was hit on my bicycle once by a drunk driver in 2000, I had a big hole in my leg, and the femoral nerve was damaged. So what we treated first is it needed scar tissue work with microcurrent, which just increases ATP and cellular metabolism. Then it needed lymphatic drainage to get all the fluid out of there. And as we continue to learn these life lessons as to what do we need now that we already don't know? The evolution of how we treat scar tissues, the evolution of how we get good spinal biomechanics, the evolution of we all share this information, and nobody should hoard trade secrets. Those nobody. I won't mention his name, but I had one instructor in massage school, and he was the top sports massage guy in the country. But he said, well, those files over there, they're off limits. And I was thinking, why would you have something that can change the quality of a patient's life, and you wouldn't share 100%? Because really what should drive us is seeing that smile on their face when they
satisfaction,
seeing them move when every doctor out there has told them there's nothing more we can do. What should drive us is to see those life differences change. The money will manifest, I believe. If you change lives unconditionally and you do something that no one else has looked at, and you have a modality, like if I can't solve the problem in a couple of sessions, I don't have a solution. So you need to look at the
ego. Let your ego go.
And I'll be honest, I used to have an ego that I'm not happy about. So thanks to Fran, she reminds me her father-in-law was the most humble man I've ever met. And someday to aspire to have that kind of humility despite your success is something I have to work hard at all the time. And I think as we do that, we connect with more colleagues. And as we work hard to get rid of ego, we actually open more doors. And I think for me, what probably closed a few doors early in my career was an ego, which is really a lack of self-esteem, a lack of security, a lack of self-confidence, and a really lack of knowledge. And so you try to overcompensate in an unhealthy way. But I think a healthy way is to realize for the rest of our lives, there's going to be somebody, we're going to walk in that classroom, and we're going to feel like we know this much.
Yeah.
No matter how brilliant you are, you're going to walk in that classroom. When a friend and I first studied with Eric Dalton, we looked at each other and we looked at George Coselius, who's been teaching at Harvard, and he said, do you know 1/10 of what he was talking about? And I said, not yet, but I was so blown out of the water. And we're always going to have that. And I think if we stay more humble, we will open our door, our mind to the evolution of manual medicine.
Yeah, and you're correct. Like I said, I took classes. Like I said, you were my first mentor. I learned from you. Then I moved on. Like I said, I went Aaron. Aaron was a game changer for me as well. You know, I learned from him. It's like never stop learning. Then like I said, the fashion conference I went to was freaking phenomenal. It blew my mind. I'm like, I listen to these trainers, these hypertrophy people talking about fashion, this and that. I'm like, you guys don't really understand what you're saying. And I don't want to be disrespectful to anyone. I don't want to downgrade nobody. I don't have a God complex. It's just, I know what I know, and I still listen to an ignorant person because you talk so big and bold. And a humble person is quiet and willing always to help. And a lot of people are that way in the industry when it comes to teachers. You know, and it comes to anybody in certain professions, but I think the student loses. You know, we lose this.
They pick up on the energy of that when you walk in the room. Yeah. The universe wants people to feel loved. And they don't want to be impressed with your level of education. They want to be educated.
Yes.
And they want to feel smart enough. And they don't want you to talk down to them.
Yes.
And I think that's important because I was like that in high school, grade school. Remember I was in junior college and my chemistry teacher goes, you don't learn by reading a book and taking a test or a lecture. And I said, no, I don't. And that was way back in the 70s when I was in college. You know, so I realized as I got older that my learning processing is very similar to my daughter. Very similar to probably a large percent of manual therapists. Yeah. And that's why we read, in 220, we redid all of our PowerPoints, we redid all of our handouts, and we made it more visual. So when you're looking at any one technique, you're seeing the hands on the ilium or the hands on the psoas, or you're seeing the SI, you're seeing not just learning techniques, you're learning why do you do each technique and why should certain techniques not be done to a client that needs stability versus mobility. So if you just teach a bunch of techniques and they don't understand what their purpose is, then they're just technique junkies. So if we teach a technique and go, this is why we do each technique. So every technique now, every single one starts and finishes with assessment. So if I check your SI and I do a correction, I reassess. Did it work? If it didn't work, I do it again and I move on. Yeah. I don't just do 3 or 4 techniques anymore. No. And
doesn't make any sense.
I don't try to impress them with, okay, I'll do this, 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 and this. This one does this, recheck. This one does this, recheck. This one does this. I think the greatest gift Fran got me was don't give so much information at one time, talk slower, and be more humble, and make sure that you don't dummy it down, but you simplify it so that every style of learner can learn what you achieved with each and every single technique.
You're killing me over here because I'm the same.
A lot of people are the same, and I'm the same.
Because you know what, when I talk to people, I understand things at a different level, at a science level, and I speak to you as though you have a degree in kinesiology, because that's the way I can process it. I can give it to you. If I give it to you less than that, then I can't really give you. I don't know, but I don't know the word I'm trying to use. It doesn't make sense to me, and I sound ignorant. But I was told too, you have to dumb it down, maybe to where a person can digest and understand, because 9 times out of 10, they have an interest, guess what they've heard? They've heard those repetitive words before, and once you hit on those points, I've heard it from my doctor, I know this from my physical therapist, I know this, you're right. Then they believe in you, you're going down the pathway of their success, of their physical success, and they have more faith and trust in you, believe in you too.
You know, for an example, I was teaching Florida chiropractic physician clinics 4 years ago in Orlando, Florida. And they called me out an hour into the lecture. And I'm teaching them the same thing I would teach in the massage class. Right? And I go, what's the problem? They go, the doctors are saying you're speaking way over their heads. What they really didn't mean is that I'm speaking over their heads, that I'm not simplifying. I won't dummy it down. No. Dummy it down means you're not going to learn about trapped nerves and scars. But there's a way to
simplify
to reboot it and simplify it. Now let's just look at 3 bones. Now let's look at this muscle. Now let's look at this nerve. Okay. If you can simplify it and combine that visual and kinesthetic learning, auditory processing, so that every brain can achieve that one simple thing, simplify, not dummy it down. So then when you simplify it, they go, oh, now I get it. You presented it in a way
that works for them. Yeah, because you said it to me, I got it. I got it. Like you open your mouth, I understand everything you're saying. But like I said, this is my field. I do manual therapy. I work with people, and I can. If you tell me what's going on the phone, I can tell you what steps to do and understand. I can tell you break down details, where your areas that you need to focus on, who you need to go see, what you need to do, and it's just my nature. But I'm not a nutritionist, but I even take it a step farther. My clients. I even talk about gut health, where your stomach is at, how your body processes minerals and nutrients that you're taking in, and I take it a farther than that. But I don't know. I'm not a nutritionist, but I understand the body as a whole working unit, not just one dimensional, which is outside that you use to move and be in. But you got to look also inner at how your body's processing what you're trying to do to help take care of the joints. Because ligaments don't bleed, ligament tendons don't bleed, the muscles do.
But even Fran's back pain, when you came here, she said she was walking bent over. And until Lynn and Ann Teachworth did visceral work, and Carrie D'Ambrosia did some visceral energetic work, and then we combined. I mean, I didn't have a solution. And there's nothing more frustrating than to know as much as you know, but not know what can help the person you love the most to get out of pain. I was really frustrated because I couldn't find a solution. So by taking her to my colleagues, and they looked at the organs and the kidneys and the liver and the the lungs and the horizontal diaphragms and the total lymphatic drainage system, I'm like, whoa, I would not have thought of that. And now I want to train with my colleagues because there's whole nother piece that's causing back pain besides muscles and bones.
And that's what I think about. I'm already there already. So I've learned, like I said, I'm a student of what I do. And I've learned so much, and I understand gut health controls your hormones, how the output of hormones, how your body deals with pain in places, how it displaces them, how it works with the fat. It has to do with every aspect of your body as you being a being. I understand that personally because, like I said, this is what I love doing. I enjoy it to the max. So I know your program. So I'll tell you what. So let's talk about your program a little bit. Let's talk about your program. So guys, we're going to get into the program. What program I first learned, my first taste of pain management is through this man right here. So we're gonna talk about a little bit of the program, a lot of his stuff that we got going on, and a lot of his CDs and we'll make sure at the end of this that we give you his teaching regimen, your class regimens, and information you need to get in touch with him to take the next step. Okay.
So 220 was a tough year for everybody.
Okay.
But it turned into a global opportunity because we redid all 11 handouts for 11 different courses.
Okay.
We redid all 11 PowerPoints for 11 different courses. We updated information like this kinetic chain shoulder DVD. That was updated to look globally, never to look at a shoulder without looking at subtalar joints, tibial torsion, sacral upslip, scoliosis, elbow joint compression. So a lot of Eric Dalton's, as we mentioned, colleagues, a lot of his spinal biomechanics is in that shoulder DVD. So we updated all of that. We teach 11 different classes. We have a upper body, lower body. Trap nerves is probably my new favorite class because we looked at, if you have carpal tunnel, where does the average person think you should treat them?
Oh, right here.
In the wrist.
Yeah.
And that's a joke because what if there's trap nerves in the neck? And what if it's scalings? And what if it's facet joints? And what if it's scars? And what if it's first, second rib fixations and clavicular dysfunction? And so we have to always look at the source. Where does trap nerves come from? Brain, brainstem, spinal cord. So we've got 3 DVDs on trap nerves that we've updated. We've got 2 weekend courses for treating trap nerves, which is really looking at joint function, ligament function. What is it? A facet joint, a scar, a nerve, and we treat all of it. So you won't go to your general practice doctor and get that kind of evaluation, that kind of clinical reasoning, that kind of special test. So all of our courses, Eugene, start with good clinical assessment, good clinical reasoning, lots of special tests. You don't know where the problem is until you evaluate. So once we do clinical reasoning evaluation, we don't evaluate specifically until we look globally. So if I look at you and you're standing there and your shoulders and hips and occiput are not level, I will not treat you specifically. I'll treat you globally. So we do a lot of evaluations, a lot of special tests, and then the key thing is we integrate modalities. And one modality is not going to solve anything.
That's true. I agree with you.
We look at spinal biomechanics, referencing people like Eric Dalton. We look at cranial osteopathic work, which I'm still studying. I'm still feel like a rookie, but I experienced a lot of it in Toronto last weekend. We look at scoliosis and do they have an anatomical or functional ligament discrepancy? And once you learn to evaluate and do clinical reasoning and special tests, then you know where to treat. And most often, I'll be honest with you, where it's hurting is not where it's coming from.
Yeah.
So if we don't, we have 2 brand new kinetic chain classes. One is kinetic chain knee. 90% of knee pain comes from your hip and your foot.
Yeah, I know.
And I don't like words like runner's knee and jumper's knee because it could be your ACL, your PCL, your MCL, your LCL, your medial meniscus, your lateral meniscus, patellar trapping, trapped nerves, fibular nerve compression, IT bands. I mean, you have to know how to
Blue stop firing.
Which one of those 11 muscles got injured around that? Which ligament got injured? Which nerve got trapped? Where's the IT band coming? You know, we know that foam rolling and forearms, elbows are not good for IT bands because you got to go to the muscles.
Oh, come on. Hold on.
No.
I'm going to tell you something.
As a personal trainer, I might be pushing some buttons.
Man, I'll tell you something.
Scientific, evidence-based.
How many times I've told people that? Doesn't make any sense. I see people, my trainer told me to foam roll my IT.
Not IT bands.
You can't, how many nerves and why would you foam roll your IT band? You're crazy.
The tightest, the most solid ligament in the human body is the IT band. They actually used to harvest the IT band. I met a doctor that would harvest the IT band to replace the ACL. He said you can't. It's got the tensile strength of steel. So when you forearm elbow and forearm roller, you're binding it down to the fascial adhesions of the vastus lateralis and the biceps majoris. So look at the muscles of the hip. Do something like cupping. Lift and separate that IT band and free up the problem. So here's the thing about. Don't sit back like I used to. If somebody would say something, well, it's not piriformis syndrome, and I cross my arms. Every time I just do that, I silently think of a friend going, uncross your arms because you're about to not learn something. Because it reminds me, myself, my own words to myself, remind me of my ego. When you
shut down.
Like you shut down. And now you go from active listening to passive listening. But you see him going,
Fred, did I tell you?
Fred's been pretty, I'll be honest with you, I would not be where I'm at today without Fran and Allison in my life. They keep me on track.
Wow.
They keep me organized. I think if you really want to give the credit to the world leaders, then you look at the people behind the scenes. And if it wasn't for Allison and Fran talking about humility, talking about integrity, talking about evolution, talking about not doing this, Fran did not.
I need to learn that.
She only triggered it in me. Whenever I do it, I'm like, okay, I can hear Fran's voice. Uncross your arms, get rid of your ego, and be humble and listen.
I like that.
But it didn't. She did anything bad. She just reminded me of
to be open-minded,
to be more humble, and to be more grateful. And I still have a lot of work to do in that field of my life. But I'm always thinking about it. And I'm always thinking, I'll see somebody in the audience. I remember one of the chiropractors, and I said the thing about the IT band, and you could tell he was phony. And he shut down. And they go, you remind me of what I used to do. I used to cross my arms and I used to go from active to passive listening, meaning you're sitting in the room, but you're not really listening. But by pointing the fingers at myself, I'm not pointing, you remind me of what I used to do, but I guarantee you that everything I do will be science-based, clinical reason. I guarantee if I can't tell you why cross-fiber friction doesn't realign scar tissue based on research, it doesn't. But if I can't tell you why, and your other teacher have been teaching you a mythology behind why it does work, I need to have the science to support my transition.
You're right. Did y'all hear that? Cross-fiber friction does not realign tissue. Gold nugget. Take that. Run with that. Take it to the bank. Make a deposit. I got that. Makes sense.
So even if you use friction or gouache or Graston, it irritates fibroblasts. So it does. The only thing that realigns scar tissue, and this goes back from 1990 to 2000. The only thing that realigns scar tissue after you lay down the fibroblasts and irritate scar is concentric and eccentric loading, specifically eccentric loading.
Hold on. Take that easy. Say that again. I want to make sure y'all hear that.
So whatever scar you friction or irritate, whether it be ART or Graston or gouache, you have to follow with pain-free eccentric loading. The frictioning irritates the scar and lays down fibroblasts.
Okay.
The gentle eccentric loading reorganizes the functional alignment of the scar. That's science. So if we challenge an old technique, we better come back with a scientific based
solution
to support that it's not coming from your opinion, it's coming from science.
Trust me. Yeah. When I say you gave so many nuggets, I mean, I'm a rich man. But I'm telling you something, you think the way I think, because this is what we do for a living, and we're into helping people. And, you know, and I know you referenced the performance. And this is your microcurrent. Okay, so we've touched base on a lot of different things. I'm telling you something. You're sleeping on your education if you consider yourself a practitioner or a person of manual therapy. Now, I do remember I used to have all his CDs. You know, but then these are different than what you have.
These are very updated.
These are totally updated. So I used to have all his stuff. Man, this guy, He lays it down. If his stuff was good back then, but if you upgrade it now based off of what's going on, it's gonna be even better. So, I mean, I'm really impressed with this man. He looks really good. He looks the same way he did back when I knew him back then. And his white friend, lovely white friend, she looks fantastic. They like never aged. They look like they just like time just stood for them and just kind of walked around it. So I'm really grateful, and I'm like really fortunate to have this time with him and just to speak with him on his busy schedule. I'm just really grateful. We're going to discuss, he's going to talk about the class. So when's your class schedule? What class you got going on?
So I have classes every single weekend now.
Okay,
I'm booked all the way through the rest of the year.
Is there a wait list?
And there's getting to be, like Dallas class just sold out. Just like the one in 2 weeks, the 5 intensive. We can only take 22. That one's pretty much sold out. We might have space for one person.
Okay.
So the numbers are picking up. In COVID they were really low, but they're really picking up, and many of them are selling out. But we have classes every single weekend. We do a 5-day intensive in Dallas every June and every October.
Okay.
And we're starting to do those globally. We have a retreat coming in Italy. That's
really?
turnkey. It's going to be a brand new course. It's going to be, what are the 3 things you would do in any one body part to drastically change musculoskeletal pain? Easy, quick, and go-to techniques. So we're always evolving, and we have we just launched a brand new 2-day elite sports therapy class.
Okay.
Which is going to be here in Dallas the 3rd week in December. So we have just go to my website, www.orthomassage.net. And right now, these next couple of weeks, I'm going to be adding about 15 more classes in 2022. So we're pretty much going to book 45 weekends a year. We're going to start to do global retreats across the world, starting in Italy next September. And our website will have all of our updated information. Okay.
And what we're going to do after we go off, I'm going to get all his information. He has his link. I'm going to put it in the bio, and we're going to make this possible. We're going to put this out as much as possible, because I think everybody that's considering themselves a practitioner, a student of their craft, you need to be continuing educating yourself. Don't act like you're above anybody else. Like I said, I see the evidence on my own, and that's only just me going against the world when it's in the sense of helping educate people, consumers, that you need to vet the people you're dealing with. Vet them. Ask questions. How long you been around? What you been doing? What's your modality training? It's not just massage therapy anymore. It's mobility. It's functional therapy. And you need to be covering the whole body. You need to be asking questions. Questions. Unless you're interested in throwing your money away. And guess what? Hey, you can send it to me. I sure appreciate it.
Two pearls of wisdom. One, I think, realize the more you know, the more you're going to realize you don't know. Number
that's
one.
true.
And number 2, I think if you really come from a place of your heart, we don't fix people, Eugene. We create the body's innate wisdom to heal itself through functional movement.
Now, I can take that one.
And we have to heal you emotionally, energetically, physically, structurally, posturally, because there can still be a battle going on in your mind that causes lots of pain.
It throws out everything.
And so our job is truly to facilitate the body's innate wisdom to heal itself.
And that's a gem right there. That's a gem that needs to be said again if you could. But what you said does make a lot of sense, because when I work with my clients, I ask questions about gut, mind, social stress, because I can work on you all day long. I can advise you. I can teach you how to do everything. Guess what you go back to the house and do? You back home and seize up again. Guess what? I don't understand. I don't want to take your money, but out of respect for you and our engagement and our communication, it's going to be what it's going to be. But guess what? I'll see you again. And that's unfortunate. But guys, it's really great having James here, and I'm gonna put in my bio everything about him, his classes, everything about his classes. We can hold his stuff, and then, like I said, these beautiful cities here. This man's a wealth of information, and he's one of the legends in the game of wellness, manual therapy. He knows his stuff, and you would not be disappointed. So stay tuned for more performance and wellness.
Great to see you, Gina.